Okay, so in this video, I'm going to show you what exposure and response prevention, also called ERP, is, and how it remains one of the most effective ways to overcome your obsessive compulsive disorder. Exposure and response prevention is used in OCD as a way of teaching you and your OCD that the distress that follows exposure to a trigger will reduce and become less of a problem for you if you don't use your compulsions. As you and your CBT therapist progressively expose you to more and more of your OCD triggers while you resist the use of your compulsions, you tend to find that you need to use your compulsions less and less. Exposure and response prevention is incorporated into the most effective OCD treatment protocols, which basically means that if your therapist isn't incorporating some aspect of ERP into treatment, then you're less likely to get the outcomes that you're hoping for. Also, it's important to note that the idea of being exposed to triggers for OCD can feel incredibly scary for many and can even lead some people to drop out of treatment. And as such, it's particularly important that you work with a therapist who will explain to you fully exactly how ERP works and then work with you to introduce the technique in a therapeutic way. So even though we expect and want you to some degree to feel anxiety as you do your exposure and response prevention, we never want you to experience anything that is overwhelming or that you believe is beyond your capacity. So with this said, let's just start talking a little bit about how exposure and response prevention works. And we'll start by beginning looking at this particular model. This model shows us the vicious cycle of OCD. And you can see here that when we are faced with a trigger for our OCD, we have an intrusion show up, which then leads to an increase in our emotional distress. We then engage in a compulsion to get rid of the distress, which, when completed, leads to a sense of relief. When we get another intrusive thought, the cycle then repeats. So what's happening here is that the relief that we experience from doing our compulsion reinforces the use of the compulsion whenever we get further intrusions. And just for clarity, when we talk about compulsions, they can be either overt or covert. Overt just means the behaviours that we can see. So it could be like the flicking of light switches, it could be checking, it could be getting reassurance. And covert is the stuff that happens in our heads, like counting, neutralising a bad thought by thinking a good one, or going over past memories to reassure ourselves. So when we're using ERP, we can target dropping both overt and covert compulsions. And this is particularly helpful in OCD subtypes in which compulsions then are external, such as say cleanliness and orderliness OCD, or internal, as in the case of pure O or sensory motor OCD. So ERP is an effective treatment in all of the OCD subtypes, even if the compulsions are not obvious. So how do we do ERP? As the name suggests, there are two components. There is the exposure and there is the response prevention. The exposure component can take a couple of different forms, but the main aim is to expose the OCD sufferer to something that will activate an obsession or an intrusive thought. So for someone who has harm-based OCD, we may trigger an intrusion by showing them a knife. In the case of cleanliness or contamination-based OCD, we may generate exposure by touching dirty door handles or a toilet seat. In some cases, it might be difficult to create the real-life conditions for exposure, so we will create imaginal conditions, say by writing an exposure script or a recording of the feared situation. And when the exposure activates an intrusion, it then leads to an increased level of emotional distress. So typically this is fear or anxiety. Now, it is common for people with OCD, where people experience problems with anxiety, to have unhelpful beliefs about what will happen if they experience too much of it. They might believe that their anxiety will just keep going and going, as we show in this particular slide. And in the slide, we can just see the anxiety kind of reaches a certain point and then just keeps going right off the scale. So rather than risk this happening, the people with anxiety disorder will people with OCD will use their compulsions instead of allowing that anxiety to go right off the scale. So looking at this next diagram, we can see that using a compulsion typically leads to a reduction in the stress. That is, that we will experience relief from our anxiety. And it's this desire for relief that feeds into continuing use of the compulsion, and we get this effect where the compulsion gets repeated every time the intrusion occurs, but the anxiety never really goes away. Essentially, we want to break this pattern, and exposure and response prevention looks more like this. We expose ourselves to a trigger for an intrusion or obsession, and then we prevent use of the normal compulsive response. And as you can see, the anxiety stays at a high level for a while, but it doesn't keep getting higher and higher as we saw in the first slide. Instead, after a certain amount of time, our anxiety begins to reduce, and this is called habituation. We are learning that our intrusion and the trigger for it are not in themselves truly harmful, and therefore we do not need to continue feeling anxious about it. And when we learn this, our body stops responding to it as a potential threat, and the anxiety goes down by itself. If we do this repeatedly, we then experience an extinction effect, and that is that the trigger and the intrusion no longer generate an anxiety response for us, and we no longer need to fill our lives with those compulsions. So, in this video, we've looked at how exposure and response prevention works in OCD. If you want to find out more about exposure and response prevention for OCD, then keep watching my other videos. And if you want to try out exposure and response prevention for yourself, then you can contact me at accesscbt.co.uk. Thanks for watching. See you soon.